Thank you very much, Emilomo. Yeah, thank you very much for giving me the slot now, and overall just inviting us at the International Labour Organization to talk a little bit about what has happened in the disability community ever since the pandemic started. And before I'll talk about the response to COVID-19, just a few basic reminders, or what I've called here the 21st century reminders about persons with disabilities. As we know, concepts and perspectives keep on changing, but it's important that we all on the same page when we talk about the concept of disability, persons with disabilities. So that's why I felt it was important to have this, let's say, opening slide. So just a reminder that sometimes we call it the biggest minority in the world. According to the World Disability Report, about 15% of the world population have one or more disabilities. And it's a very heterogeneous group, of course, because we have men, women, transgender people with disabilities. We have people with disabilities of diverse races and ethnicities. Of course, different ages. You can be born with a disability, or you acquire a disability in teenage years or in old age. Then, of course, the disability itself or the impairment is very different, right? You can have sensory disability, like being blind or deaf, hard of hearing. You can have a physical disability, that's, for example, an amputee. You can have an intellectual disability like Down syndrome, or a psychosocial disability. And we just heard in the presentation before that, of course, mental health issues are on the rise during this pandemic. There again, I just realized I've aged twice here on the slide. Anyway, so old age, young age. Sexual orientation, socioeconomic status. Of course, there are many other factors that could be considered when we think about the identity of a person. Well, there on the right-hand side of the slide, you see also, of course, religion is also such a factor. Anyways, just to keep in mind that it is not a, oftentimes when people think about people with disabilities, the first thing that comes to mind is a male wheelchair user. And of course, the group of people with disabilities is as diverse as society. Then important, of course, that in 2006, the UN Convention on the Rights of Persons with Disabilities was adopted. And this is, so to say, the most comprehensive legal framework we have in the area of disability rights, because it spells out the human rights of people with disabilities, which they always had, of course, but they were not clearly defined, or not in such a comprehensive global framework. And it has been ratified by almost all countries within a few years, actually, when you think about it. Usually these ratifications take much longer, but all member states of the United Nations felt this was a topic that has been overlooked for too long. Then when we talk about disability, and that's actually going back to the first point, 15% of world population. So who is actually defined as having a disability? Who is a person with a disability and who is not? And in fact, these statistics are always a bit tricky, because you can have a very strict cutoff or more relaxed, so to say, and that would always, of course, bring down or up the number of people with disabilities. In a more conceptual way, we can say, and that's taken from the UN Convention on the Rights of Persons with Disabilities, that disability results from the interaction between persons with impairments and attitudinal and environmental barriers. Or a more simple formula could be impairment plus barriers equals disability. So we move away from an individual approach to disability, where we say, look, the challenge is within the person. No, we move it to the society, to the societal context, the environment that needs to be accessible, that needs to be inclusive, and that's the social model of disability, as we call it. And then the last point on this slide, just to remind ourselves that Agenda for Sustainable Development 2030 explicitly refers to persons with disabilities. Unlike the Millennium Development Goals, where disability was totally absent. So now, as the SDGs, as the Global Development Framework, we have a number of references explicitly talking about persons with disabilities and concrete targets on how to bring persons with disabilities better into the development framework, including in the area of employment. Since I work at the International Labour Organization and our team promotes the inclusion of persons with disabilities in the labor market and in social protection schemes, this is a bit of the focus of my presentation. When the pandemic started, it was really, well, it was interesting. Well, interesting is a word that doesn't say much, but it was great, actually. It was really great to see that, well, organizations of persons with disabilities, OPDs, then NGOs working for the rights of persons with disabilities, but also UN entities like the ILO. I haven't listed here the ILO, but we have another slide on that. They all came up with very quickly with statements and guidance on how to make sure that the response to the COVID, the immediate response at least, would be inclusive of persons with disabilities. And that's, of course, essential, because we have heard before, if we don't bring marginalized groups into the design of responses from the very beginning, they are forgotten. And despite all these statements and guidance from the disability community and NGOs and UN entities, of course, it's unfortunate that still in many contexts, people with disabilities don't enjoy the same rights when it comes to the COVID-19 response. So we see, and I hope we can share the presentations after this webinar. So they will have all the hyperlinks to the different guidance documents, but that's just a selection of some of the most important ones. We also see the World Health Organization here, because many of you might be working in the health area. And just to mention that, of course, that the challenge persons with disabilities face, that those who contracted COVID or the coronavirus, that some of them even did not get access to the medical care they would have needed, because again, the worth of the life of a person with disability was put in question. If a doctor had to treat somebody without a disability or somebody with a disability, it was more likely that a person with a disability would be sent back home. So this is obviously a very direct discrimination, which could and did lead to death among people with disabilities during the outbreak, and still, of course, during the ongoing pandemic. And we know that, and that's why we also here in the webinar talking about marginalized groups that are at higher risk of vulnerability, and people with disabilities are such a group. As we said, it's a very heterogeneous group. But looking at some, I mean, I'm just picking here one example of employment to population ratio, right? The employees. So what is the ratio of people employed compared to the overall general population? And when you then disaggregate this data by persons with disabilities and persons without disabilities, and then adding this layer of disaggregation by sex. So we have women with disabilities, men with disabilities, women without disabilities, men without disabilities. And you see in all regions of the world, and I think except for Europe, we have countries here on this slide from all regions. You see that it's always the persons with disabilities who have a lower employment to population ratio. So they are less likely to actually be employed. And these statistics come not from this year, but from years before. So we know, of course, that persons with disabilities came into the COVID-19 crises already disadvantaged in the labor market and, of course, in many other areas of social life. This is just one example from Uganda, where the International Disability NGO Light for the World, together with a radio station, conducted a survey in, what did it say here, in April, end of April. So a few weeks after the pandemic had become global, so to say. And it was not really the access to health at that point that was worrying for people with disabilities, but mostly the question, how do I feed myself? How do I feed my family? Because, you know, in many places of the world, the economy was shut down, and so the people with disabilities, like many other people, could not make an income, or still cannot. So the biggest concern was actually not getting access to medical care or even being infected by the virus. You see here, it's like the concern that was least least worrisome, so to say, but it was really the economic impact of the lockdown and the recession that's likely to follow. It's really, how do I feed my family? And here's some quotes from two women, one in Bangladesh and one in Kenya. This was a survey done by the Innovation to Inclusion program funded by the UK government, operating in Bangladesh and Kenya, just to give you a bit of a more human face of what it means for persons with disabilities. And Salma in Bangladesh said, "I'm very worried about my job security. The dress factory where I work as a sewing machine operator is fully closed. If I lose my job, I will be treated as a burden of my family." It relates to the fact that, you know, even if people with disabilities get a job, they're likely to be the ones losing the job first. Esther in Kenya said, "We were dismissed on the basis that we shall spread the virus faster than those without disabilities. The reason was that we use our hands to support ourselves. We are also not able to reach the taps when washing hands." So the first part of her statement shows that there's this disability-based stereotype that just because you have a disability, you're more likely to, well, contract and spread the virus. And then the second, or the last sentence here, "we are also not able to reach the taps when washing hands," shows that accessible environments are just not there, right? In companies, but also when it comes to basic sanitary services. So when we then think about what happens in the recovery, so of course the lockdown happened in most countries, and that very much affected, of course, the economy and the livelihoods of everybody, including people with disabilities. And then there was an assessment done, I think that might have been May or June this year, where an initial assessment of 19 national plans were done, and looking at how much they included people with disabilities and their needs. And the pie chart there on the right shows you that almost half of them were absent. Absent of disability issues, so they didn't mention person with disabilities at all. Then around 37%, they mentioned people with disabilities, but together with a number of other marginalized groups. Then about 11%, so that's 2 countries, they mentioned people with disabilities explicitly, but didn't have any concrete recommendations on how to address their needs. And only 1 country in this initial assessment had in its socio-economic recovery plan explicit reference to persons with disabilities and recommendations on how to address the needs of persons with disabilities. So obviously this is a huge gap and an oversight in the design of these plans. And I'll just and I hope you can get this presentation afterwards, so you can read it for yourself. But just 6 points that I think are effective approaches we have seen now, and that's basically even more important during the pandemic, but of course it has been true for even before. The involvement of persons with disabilities in their respective organization, that's always key. Whenever you design a policy, when you design a program, you need to have the voices of persons with disabilities represented, so their needs are appropriately reflected and can be addressed. And that same is true, of course, in the design of COVID-19 responses. All the responses or solutions, of course, they need to make sure that human rights are respected and equality is promoted, so people with disabilities enjoy equal access to whatever it may be in the area of work, and with a move to telework from home, it's clear that employers need to provide the reasonable adjustment, the reasonable accommodations for the workers with disabilities, so they can do their job from home as effectively as they could have done it from their offices or from their, of course, if telework is possible. It's not possible in all industries. Communication, there are 2 points about communication. Obviously, communication needs to be provided in an accessible format. That could be, for example, sign language for sign language users, mostly deaf people, subtitles, accessible websites, and so on. And also easy to read communication for people who might have an intellectual disability. And the communication itself should not only be accessible, but it should also refer to the particular situation of persons with disabilities in the current pandemic. The second slide on effective approaches. Social protection is obviously key, and many countries, many governments have used social protection at the very beginning of the pandemic to kind of alleviate the impact, the socioeconomic impact on certain groups, including persons with disabilities, where direct cash transfers happened, or money was just wired to beneficiaries. So that helped, but obviously that cannot be a one-time thing. It needs to be sustainable, and social protection can help. Well, it needs to be designed in a way that persons with disabilities are not tied to a disability benefit instead of going to work, right? So a disability benefit should always be flexible enough to accommodate the income person with disabilities would generate by working, and not be penalized by having a job. Then the second point here, visibilize disability in data and reporting. Of course, what is not measured cannot be improved. In many statistics, people with disabilities, let alone women, and I mean, let alone a disaggregation by sex, is not happening. So we don't even know what the situation of persons with disabilities is like. So we always need to push for disaggregation of data by disability, including, of course, in the labor market, and also in reports, obviously. And the last point here is, there's this OECD DAC, so the Development Assistance Committee, and it has it since, like, I think last year or the year before, I'm not even sure right now, but they have a disability marker. And with this disability marker, development partners, donors, can actually track how much of their funding is used for promoting the rights of persons with disabilities. And in the current pandemic, it would be advisable to also use this marker to see what actually happens with the funds we use to address the COVID-19 crisis from a disability perspective. Then one thing that I would like just to share, because a lot of time I also spent in supporting the ILO Global Business and Disability Network, which is a coming together of 25 global companies, more than 30 national networks of disability inclusive companies. And we did a survey just to understand what they were doing, how they were reacting to the crisis from a disability perspective. And well, not so surprisingly, but just to show you the top 3 measures taken by companies that employ people with disabilities. Obviously, these are not only disability-specific measures. They usually would apply to all workers or the majority of workers. It's telework, flexible working hours, and paid leave. Here, maybe if you watch the recording, just hit the pause button, or if you have the presentation, you can also click on the links here in this slide. You will find the key resources, the key guidance we have developed here in the International Labour Organization for employers, trade unions, governments, and organizations working on disability rights on how to promote a more disability inclusive COVID-19 response. And with this, I would like to end my presentation and thank you very much.